Which of the following sentences uses the correct tense and structure for a discharge summary? So here you have to choose the sentence which has the correct tense usage, past tense, present tense, and future tense, and also the right structure for a discharge letter. So when you're writing an OET writing discharge letter, among these four, which would be the right sentence? You need to have good grammatical accuracy here. Yes, so we have the patient was discharged yesterday with medication. So that is what everyone has gone by. So let's see if that is the right answer. Okay, so good. The patient was discharged. Okay, so why is that the right answer? So what is the tense over here? Past tense. Okay, so ED. Okay, ED. So here also it's a simple perfect past tense over here. And see, yesterday past tense, right? With medications. Now the patients had been. What is had been? Had is past continuous tense. Okay, BEEN. Okay, so that is past continuous tense will come. So discharged is a perfect tense, perfect past tense. Okay, so that will not be the right. The patient again has discharge will not come, was will come, and the patient is. So is present tense, and we cannot use is for yesterday. Okay, because so that correct tense usage you must have. Okay, so good. Again, especially in listening and reading, fill in the blank questions. For fill in the blank questions, this type of grammatical accuracy is very, very important. Right. So now let's take a look into the second question over here. The second question is choose the most appropriate word to complete the sentence. Okay. So here you have to bring in your vocabulary skills. Due to the patient's dash history of smoking, a full respiratory assessment was necessary. So here you need to give importance to the vocabulary here. History of smoking. Due to the patient's dash history of smoking, a full respiratory assessment was necessary. All right, so the correct answer is basically answer option B, extensive will come. Because why is extensive the right answer? Because over here they are not talking about smoking. Smoking is a quantity, okay, 10 cigarettes a day, 20 cigarettes a day. So we can say excessive smoking if we are only talking about the number of cigarettes. But over here, we are not talking about the number of cigarettes. We are actually talking about the history. Okay, the history is timeline. Okay, so timeline, that is for how long the patient has been smoking cigarettes. Okay, so here we cannot use the quantitative word, which is excessive. So here you have to use extensive. Okay, because extensive shows the extent of the patient's smoking habits. That is for how long the patient has been smoking. Okay, so the right answer would be B, extensive. Okay, so good. So again, it's a slightly tricky question. Let's go to the third question over here. Identify the grammatically accurate and professionally appropriate sentence for a referral letter. So if you're writing a referral letter, what sentence, what grammar would you use? Identify the grammatically accurate and professionally appropriate sentence for a referral letter. So what is a referral letter and what is a transfer letter? Referral letter basically means you are giving partial responsibility to another person. That is, you're still taking care of the patient, but now you're giving partial responsibility of the patient care to another person. That is what we call as referral letter. What is transfer letter? Transfer letter basically means you're giving full responsibility of the patient to another person. Right. So among A, B, C, and D, the right answer is C. Okay. Because over here we have the word I am referring. Okay. So it's a referral letter. So I'm referring Mr. Dawson to you for further urological evaluation. So that means you're giving partial responsibility. You're not giving full responsibility of the patient. You're still taking care of the patient. But when it comes to urological evaluation, the patient needs specialist care. So you're giving partial responsibility to the person. If it is transfer letter, you will be giving full responsibility, A to Z responsibility of the patient to the urologist. Right. All right. So let's go to the fourth question. Which sentence demonstrates proper use of a conditional structure in a clinical scenario? That's basically, just the grammatical accuracy only over here. Here it is your grammar that is being asked. Give importance to the grammar, you can very easily choose the correct answer. Right. So we're going with C option over here. So C is the right answer. Okay. So as you can see, just one look itself, we can say that is the right answer. So if the medication will not work, the dosage increase. So the medication will not, will is where it is in the future, right? If the medication does not work, that is in the future, if the medication does not work. But what is the tense over here? Past tense. Okay, so here it is future tense and here it is past tense. So there is a mismatch of tenses. So we can't choose A. If she had taken the vaccine earlier, she may have avoided the infection, or she could have avoided the infection. So that is an incomplete sentence. Again, the grammatical accuracy is not there. C option, if he had been careful, will come. If he had been careful, he wouldn't have fractured his wrist. Okay. Let's go to the last question for the day, and then let's discuss reading part C. What is the best synonym for the word deteriorating? So it's a slightly easy question. Deteriorating. A very difficult word to pronounce also. Deteriorating. Yes. Okay. So the word deteriorating basically means worsening. Okay. Or, the condition becoming worsening or, increasing in intensity. Okay. So over here, it is declining. Or the best synonym for the word deteriorating clinical concept, the patient's health condition is declining. Okay. So that is the synonyms. Okay. And why is synonyms very important? Synonyms are very important in all exams: listening, reading, writing, and speaking. So, for example, when you are speaking, don't use the same words you see in the patient case cue card. Okay, if you bring in your own synonyms. When you're writing OET letter, don't use the same words you see in the patient case note. Write with your own words so that you show your vocabulary skills. Listening and reading. Why are synonyms very important? Because the questions will have a set of words, but the audio or the paragraph will have a completely different set of words. Right. So that is about um, the importance of synonyms and paraphrases in OET. Right. So now let's take one OET reading. Okay. So what shall we take today? How about we take hmm, C, right? Management of bones, shall we take? So this is definitely a Cambridge University material, and this is exactly how your real examination will look like. Okay, your real question paper will look like exactly like this only. So there will be a lot of rules over here. Okay, you will have to write candidate number, profession, candidate declaration, your signature over here. Okay, and as you can see on your examination day, you will definitely be able to see this logo. So what's the logo over here? Cambridge Boxhill Language Assessment. So remember, the OET is designed for medical professionals. Okay, and only a person with decent English language skills and qualities of a good medical professional will pass the OET. Okay, like a person with really good English, but coming from other backgrounds, like the engineering background or the business background, they will really struggle to pass the OET. Not because it is all medical related, but because here the skills, okay, the skills that are necessary is very much related to the skills that a medical professional must have. Okay, so in OET reading part A, you need to have good time management skills. Okay, prioritization skills. Okay, and again, like there are several other skills, right? That we discussed keyword analysis, and all that, skimming, scanning. Okay, so there are sort of skills over the way you think is extremely important. Okay, how you strategize, and then when it comes to reading part B, so there'll be 20 questions in reading part A, and then there'll be six questions in reading part B. So all these six questions will be workplace related questions. Okay, that is, medical guidelines, medical emails, medical reminders, medical instructions, instruction manuals for medical equipments. So you must be able to understand those type of documents. Okay, and then there will be the one multiple choice question, and that too with a limited time, without taking too much time. You must be able to choose the correct answer option. And then we have OET Reading Part C. Right? So what is OET Reading Part C? Here we don't have workplace documents. So here no longer emails, no longer memos, no longer reminders, no longer guidelines, no more policies, no more protocols. Okay. Here everything is basically a passage that has been written by a person. Okay. So a scientist or a medical professional or a doctor, okay, an expert in some health topic has written a particular passage. So it is basically a conversation. The writer is speaking to you. Okay. And the questions will be asking, what is the opinion? Okay. What is the suggestion? What is the recommendation? What is the attitude of the speaker, of the writer? Right. And what does the person try to say by using this phrase? That's what we call as vocabulary type questions. And then you can also expect, so as you can see, this is a vocabulary type question. They'll give you one particular phrase over here, and you have to read the entire thing, and you need to determine, okay, like this is the message that this person is trying to give me. Okay, that's vocabulary type questions. And you can also expect reference type questions. So reference type questions means what? They will use, they'll give you certain words like this, that, and all. Okay, and you have to find to what information this is referring to. Okay, so is this word referring to this information? Is this word referring to that another information? So that connection you must be able to make. So that's what we call as reference type questions. Okay, and then you can expect inference questions. Inference questions basically means you have to read the entire paragraph and you have to reflect on it. Okay, you have to come to your own conclusion. It will be, they will not directly mention this is the answer. You have to come to your own conclusion. You have to come to your own understanding. That's what we call as gist type of questions. And then we have direct question, that is detail specific questions. Detail specific questions basically means they will ask you one particular detail. Okay, so you just have to choose the correct detail from there. So that is slightly easier compared to other types of questions. Okay, now over here, we will do the very first question. Okay, so first I want everyone to be able to do the question on your own, and then we will have the discussion. So let me see if I can bring in both. over here. Just give me a second. So it's about allergic to eating. Okay. So, the main topic over here is food allergies, allergic to eating. Okay, so we'll just, okay. So this is the question, and this is the associated paragraph. So I'll give you 2 minutes time maximum to choose the correct answer. Hmm. So it doesn't matter if your answers go wrong. You learn from your mistakes only. So if you have a particular answer to say, type in the chat box. No one is going to judge you over here. All right, so I'll give you like 10 more seconds and then we'll have a discussion. Okay. All right, so let's have a discussion of the question. So one of the most important thing that you need to do is, identify, what type of question we are dealing with. Okay, so that is the first and foremost thing we need to do. So let's take a look into the question. Allergic to eating. So let's take a look into the seventh question over here. Now, here, the question over here is the case of Lucy Smith highlights the fact that food allergies. Now, over here, the writer. So remember when I told you that this is a conversation. Okay, so we have a person who's speaking to you in a written format. Okay, so what is the writer telling us? Okay, so what's the writer doing? The writer is using a patient case. Okay, so he is using an example. Okay, he is taking a specific patient's case as an example. So the patient's name is Lucy Smith. Okay, and now the question is the case of Lucy Smith highlights, okay, the fact that food allergies. So here, this what question type is it? What type of question is this? So this is a purpose type question. Okay, purpose. So I'll tell you why it is a purpose type question. Purpose. Okay. Purpose basically means what? Why or the reason. Okay. Now you have to understand, okay, why is the writer using the case of Lucy Smith? Okay. So the writer is using the case of Lucy Smith to tell us one fact about food allergies. Okay, so he wants to inform us. He wants to give us an information, one specific fact about food allergies. And to do that, okay, so to give us that information, he is using an example of a patient case called Lucy Smith's case. Okay, so what is the purpose? So this is a purpose type question. Okay, so for what purpose? Okay, is he using Lucy Smith's case over here? Okay, so now you have to read this entire paragraph and you need to think, okay, why did the writer use this particular person's case, okay, to give me what information? Okay, what is the purpose of using, what is the purpose of using Lucy Smith's case? That is what you need to understand. Okay, so purpose type question. Now, let's take a look into the first answer option. What's answer option A? Okay, may be difficult to diagnose in certain people. Now you see over here, this is the last word over here, food allergies. Okay, so he wants to give us one information, one fact about food allergies using this particular patient's case. Okay, so he wants to tell us that food allergies may be, may be difficult to diagnose in some certain people. That is, in some people, it is very easy to diagnose food allergies, but in some people, it may be very, very difficult to diagnose people with food allergies. And to give us that information, to make us understand that information, he is using Lucy Smith's case. Okay, so that is the purpose of Lucy Smith's case. Now let's come to answer option B. Okay, so here he wants to inform us that food allergies are relatively rare in the adult population. Okay, so he wants to inform us that food allergies are relatively rare. Okay, that is, it is very, very uncommon. Okay, in the adult population. So in the adult population, food allergies are extremely rare. So to inform us that, he is using Lucy Smith's case. Now let's come to answer option C. He wants to inform us that food allergies can cause debilitating symptoms. Debilitating symptoms means what? Almost like handicapped. Okay, that is, it completely shatters our ability to function properly. That is what we call as debilitating. Okay, that is, we are not able to do anything. Okay, that those type of symptoms is what we call as debilitating symptom. That is, it completely shuts down our ability to perform. Okay, that's what we call as debilitating symptoms. So he wants to inform us that if a person gets affected with food allergies, people can get these type of very serious symptoms. So to inform us that, he's using Lucy Smith's example. Okay, that's the purpose of that case. Now let's come to the last option over here. Food allergies can cause urgent treatment. Okay, food allergies require urgent treatment. That is emergency treatment. Critical care very, very quickly is required to treat food allergies. So to inform us that, okay, he is using the example of Lucy Smith. That is the purpose of Lucy Smith's case over here. Okay, so now you have done the keyword analysis. So this is what we call as keyword analysis. That is understanding the question type, identifying the keywords, registering those keywords into your mind. And obviously you have to you should expect for synonyms. So if you're expecting the same words to repeat in the answer options, it is going to be very difficult. Okay, so keyword analysis is very important. And more important than the paragraph is always the question, because the OET is not giving you marks for reading the paragraph. The OET is giving you marks for reading the question, for answering the questions. So questions are always your number one priority. Okay, that is extremely important for you to understand. Now let's do the verb analysis, because we need to bring in the elimination strategy, right? Because the OET people is they are doing the best to make it very easy for us. Okay, we have only multiple choice questions. So we have to select the correct answer. Okay. And what is the easiest way to select the correct answer? by eliminating the incorrect answer options. So even if it is a very difficult question, you should be able to eliminate the incorrect answer options. And whichever answer option is the most difficult to eliminate, that will be the right answer. So for that, that verb analysis will definitely help you out. Okay, so let's do the identify the verbs over here. So the case of Lucy Smith highlights the fact. Okay, so what fact is being highlighted by the giving by using the example of Lucy Smith? Okay, so let's do the verb analysis over here. Answer option A, it may be difficult to diagnose. So what is the action over here? What is the verb over here? Difficult to diagnose, right? So he is using Lucy Smith's case for this purpose. So he wants to inform us, okay, food allergies are very difficult to diagnose. Okay, and for that, that's the reason why he is using Lucy Smith's case. Now, what is the verb in answer option B? Are relatively rare in the adult population. Okay, so we can say it is rare. Okay, so in the adult population, the incidence, okay, the incidence of food allergies is very rare in the adult population, and that is the fact he wants to tell us by using Lucy Smith's case. Now, what is the verb in answer option C? Can cause debilitating symptoms. Okay, so debilitating symptoms. That is the verb over here. That is the action over here. Okay, so we can say that is the main focus. That is the main fact he wants to tell us. And finally, what is the verb in answer option D? It often requires urgent treatment. So this is the moment over here, right? Food allergies, they need urgent treatment, and to give us that information, he is using Lucy Smith's case. Okay, so now you see it's become smaller. Okay, now the big sentences, it has become much more smaller, difficult to diagnose, rare in the adult population, debilitating symptoms, and urgent treatment. Now let's go to the first paragraph over here. Okay, so let's go to that. So the memory of the question. Okay, you should have a very good memory of the question. Okay, Lucy Smith's case is highlighting what fact. So it's a purpose-based question. So let's take a look into the first question of the first paragraph over here, and let's understand what the speaker is trying to tell us. All right, so here he is telling Lucy Smith. So directly itself, he's talking about the patient case. Okay, Lucy Smith was strolling through Canberra last July. So Canberra is a place in Australia, and she was strolling. Strolling means what? Very casually walking. Okay, that is in a park and all, how we will walk very casually, very slowly. We will walk, right, with our hands free. That's the meaning of strolling. So she was very casually. She was very normal. Normally, she was walking through Canberra, it's a place in Australia, last July. First sentence. Now, the second sentence, what is the writer telling us? Within moments, that is within suddenly, that is within moments, that is seconds, suddenly she could not even stand. She was walking, very normally she was walking, but suddenly what happened? She could not even stand. Okay. She was gripped by pain so severe. Suddenly, severe pain came. Okay. And she feared she would pass out. What's the meaning of pass out? Consciousness going away. That is, she thought she is going to become unconscious. So this is a figurative speech. Okay, it's a phrase over here. So she became very scared. She could not even stand. She got very severe pain, and she was thinking, "Oh, I'm going to become unconscious." Okay, and now the writer is saying this is the first sign of paralyzing diarrhea. Okay, so what is the problem she's having? Okay, what's the diagnosis? Paralyzing diarrhea, and this is the first indication. Okay, these symptoms are the first indications of paralyzing diarrhea. This dramatic episode, okay, this dramatic incident turned out to be caused by a newly acquired food allergy. Okay, so this particular paralyzing diarrhea, okay, the reason for that, the underlying reason for that is a newly acquired food allergy to red meat. Okay, so we have white meat and we have red meat. So white meat basically means poultry, like chicken, duck. Okay, those are what we call as white meat. Red meat are basically like meats that come from cows, buffaloes, pork, goats, sheep. Okay, those type of meat is what we call as red meat. Okay. Okay, so what did she develop? She ate red meat and she suddenly developed a food allergy. And because of that, she got paralyzing diarrhea and the signs were severe. Okay, severe symptoms. She could not stand, severe pain, and she thought she's going to pass out. All this happened very, very suddenly. Now, the writer is telling food allergies affect 1% of the adult population of Australia. Okay. So here the writer is saying in Australia, this particular affects 1% of the adult population. Okay. Most don't hit with the same force as Lucy. So most times when a person gets food allergy, it is not going to be this intense. Okay. It is not going to be this intense as Lucy's problem. But the physical and mental impact can nonetheless turn a person's life upside down. But here, what is he saying? Now, see the word but over here. What is the word but? But is basically a, what is it? It is a contrast phrase, right? We can say it is a contrast phrase over here. Contrast phrases are basically what? Okay. Contrast phrases are words that signals a change. Okay. It signals a change over here. Now see, this is a positive statement. Most don't hit with the same force as Lucy's. That is, most times when a person gets food allergy, it is very mild. Okay. It is not very intense. So this is a positive information. Now from a positive information, we can say what is going to come is going to be a negative information. Why? Because the word but is coming. So but is a contrast phrase that signals a change. Okay, now here she is saying, the writer is saying, but okay, the physical and mental impact can nonetheless turn a person's life upside down. So even if it is a very mild thing, even if it is a very mild food allergy, even then also it has very negative impacts. The physical impact as well as the mental impact can turn the sufferer's life upside down. Okay, that is the word over here. Now let's keep reading, and may even be life threatening. Now you see the impact can be life threatening. Lucy deduced. Deduced basically means what? She came to a conclusion. Okay, deduction. Deduction basically means coming to a conclusion. So she came to a conclusion that she was allergic to red meat. Okay, so this was the conclusion. She came to a conclusion. Okay, I am allergic to red meat. One of the less common allergic foodstuffs. Okay, so this is a very rare food allergy. It is not very common. Only after several further attacks. And now what happened? She got in the future, she kept on getting more further attacks of varying severity. Was her suspicion eventually confirmed by a specialist? So then she kept on eating red meat. Every time she kept on eating red meat, she kept on experiencing these type of attacks. And then she went to the specialist and it was confirmed. Yes, you are allergic to red meat. Okay, so this is the paragraph over here. Now, what was the question type? The question type is a purpose type question. So you need to understand, okay, why is the writer using Lucy Smith's case? Okay, to give me what information? Okay, to tell me what information is he using the case of Lucy Smith? Okay, that is what you need to find out. So let's come to answer options A. Okay, let's do the verb analysis. Now over here, what is the verb over here? Okay, what is the verb? It may be difficult to diagnose. So do you think that is the right answer? No. Okay, because what did we read in the last paragraph? The last sentence, what did we read? Is that she got further attacks and then she went to a specialist and immediately the specialist immediately confirmed her diagnosis. Very easily, the diagnosis was confirmed, right? So that is not what the message the writer is trying to tell us. Okay, that is not the fact he's trying to tell us. Okay, so what we can do? We can eliminate answer option A. A is incorrect. Now let's come to answer option B. Now what is the verb over here? They are relatively rare in the adult population. So is this mentioned? So we can say to a certain extent, okay, not 100% mentioned, but like 95% of it is mentioned. Relatively rare in the adult population. So let's just go over here to the first paragraph. Now you see over here, what is the writer telling us? The writer is telling food allergies affect 1%. Okay, so for the sake of argument, let's say 1% is rare. Okay, of the adult population of Australia. Okay, that is in Australian adults, they get affected 1%. Okay, but in the answer option, they are not talking about Australia. Here they're talking about the entire adult population. Entire adult population of the country. Okay, so that's why I told you it is like 95% mentioned. Okay, but even okay, let's say here they have written Australian are relatively rare in the let's say this is the word they have written. So let's assume that they have written this. Okay, food allergies are relatively rare in the Australian adult population. Even if Australian is mentioned, do you think we can choose answer option B? Even if it is mentioned. So here they have mentioned, right? They have mentioned that, 1% of the Australian adult population is affected by food allergies. But do you think that is the purpose of using Lucy Smith's case? Okay, so that is not the purpose. The writer is not using Lucy Smith's case to talk us about, to tell us that food allergies affect 1% of the adult population. It is very rare. Okay, that is not the case. That is just a fact. That is a detail, that's a specific detail coming over here. Okay, that's the reason why it is very important to identify the purpose, the type of the question. Okay, but let's come to answer option C. What is the verb over here? The verb over here is these type of um, uh, food allergies, it can cause debilitating symptoms. So now you go once again to the paragraph. Okay. Now you see over here, he is using Lucy Smith's case. Okay. So Lucy Smith, she was walking very happily, very normally she was walking. Suddenly she could not stand. Suddenly she got a pain very severe. She thought she is going to pass out. Okay. And what is the person saying? Physical impact, the mental impact can become very, very life threatening. Okay. It can turn a person's life upside down. Okay. And that is the, so what the debilitating symptoms. Okay. Now, as you can see over here, the debilitating symptoms are mentioned everywhere. Okay. So in the second sentence itself, now she could not stand. Okay, she had pain so severe. Okay, she thought she was going to pass out. Okay, first signs of paralyzing diarrhea. Okay, and then you see the physical and mental impact. Okay, it can turn a person's life upside down. It can even become life threatening. Now you see over here, these are all the debilitating symptoms. And don't you think the writer is giving us, okay, so he's using Lucy Smith's example to tell us this fact. So now we are even more convinced. Okay. So here he's using the example of Lucy Smith and he's trying to convince us that this food allergies can cause life-threatening complications. Right. So that is the purpose of Lucy Smith. So that is the message he's trying to tell us. Okay. And over here, what is written over here? Okay, 1% of the Australian population. So even though that is mentioned, that is not the information he wants to tell us by using the example of Lucy Smith. Okay. Now, like this, you need to be able to think. Okay, so what will be the more likely answer over here? So the answer option that you should be choosing will be answer option C. Okay, so C it will be the right answer. Right. So, or you can put a question mark. Okay. So if we have not yet gone to answer option D yet. So what we have done, we have like eliminated A, we have eliminated B, because why is A eliminated? A is eliminated because difficult to diagnose. Okay. That is the exact opposite. Very easily, the specialist diagnosed Lucy Smith. Okay. Now, relatively rare in the adult population. Again, here they are not talking about the whole population of adults. It was talking about the Australian population. But even if Australian population is mentioned also, okay, we cannot choose that because that is not the reason why they are using the example of Lucy Smith. Okay, so we cannot even, okay, so that is even though it is mentioned, okay, even though it is mentioned, that will not be the reason why. That is not the purpose. Now, what about the verb in answer option C? Can cause debilitating symptoms. So he's trying to convince us food allergies can cause debilitating symptoms by the example of Lucy Smith. So we can strongly suspect that C could be the right answer. Now, what is the verb in answer option D option? It often requires urgent treatment. Okay, that is very, very critical treatment it requires. So can we choose that? No. Okay, because why? Okay, the patient had further attacks. Okay, so many attacks she kept on having. Okay, and only after so many attacks only she finally went to a specialist and she got the diagnosis. So it is not a very serious thing where urgent treatment is required. Okay, that is not the information the writer is trying to tell us. So we can eliminate answer option D. So that leaves with answer option C. Okay, the answer option, which is the most likely to eliminate. Now, over here, if you do suspect, so if you feel like B is correct and also C is also correct, so now you have two answer options and you can, so this is something that I tell to students, okay? That is, you try to eliminate the answer options which are very obvious. Okay, answer options which are very obvious to eliminate, you eliminate. And then you will have, usually you will have two answer options. You will have two answer options which you feel, and you will feel both of them are correct. Okay, so at least you have eliminated two. Now you just have two answer options. So now you go back and forth. You read the question, you understand what the question type is, you understand what the keywords are, understand what the verbs are, see if it is mentioned. Okay, see if the keywords are mentioned, and then you try to eliminate the answer option, which is the most difficult to eliminate. Okay, so in this case, answer option C will be the right answer. Okay, so slightly tricky question, not a difficult question. I would say it is not a difficult question. It is easy, not too easy, but yeah, it is a manageable question compared to other questions. This is a little bit more manageable, but it is tricky. Okay, it's a little bit tricky question. Now we are going to the eighth question, and this one is also a little bit tricky. Okay, so let's see if you're able to um, manage this one. So let's go to the second paragraph. Okay, so identify the question type. So once you have identified the question type, then you try to do the keyword analysis, the verb analysis and all that. Okay. Mhm. Yeah. Sometimes it's a little bit tricky. Just give me a second. What point is made? Okay, so just remember the question over here. The question over here is, okay, let's just try to, it's visible, right? Okay. No. So I'll give you a couple of minutes time. Very good. Okay, so we have answer option B that you have chosen. Okay, good. Very nice attempt. Okay, so now let's go to the discussion part. Okay, so this is the second question paragraph over here, and second question, allergic to eating. Okay, so good. I appreciate the participation. Right, so now let's go to the eighth question over here. Now, what question type is it? So the first question was a purpose type question. That is a reasoning type question. Okay, that is we have to use our reasoning skills. Okay, why did the writer use Lucy Smith's case? But what is the question type over here? The question type over here is detail specific question. That is, they are asking you one specific detail. So in the second paragraph, what point is made about food intolerance? Okay, so see, here it was food allergies. Here it was food allergies. Here, the keyword over here is food intolerances. Two very different things. So regarding food intolerance, what detail, what specific point has been given? That is what we need to find out. Okay, so the detail, so this is not a purpose type question. So here you don't have to think like the writer and all. You just have to, okay, this is about food intolerance. One specific detail has been mentioned. And among these A, B, C, and D, what specific point is that? That is what I need to find out. So let's read answer option A. Answer option A, scientists continue to disagree about their root causes. Now, I just want to, before I talk too much over here, now see this word, there, and they, and them. Okay. Now these are, words that actually, what we can say, these are actually words that actually gives us a reference. Okay. These are words that actually refer to one particular topic over here. Now we can say that the word them. Okay. So what does the word there refer to? Okay. So now there, the word them, they, okay, the distinction between them. This is a skill that you should have, because without this you will become even more confused. So over here scientists continue to disagree about their root causes. So over here there is actually they are talking about food intolerances. Okay, and over here they're telling, okay, that is they can have an unpredictable impact. So they means what? Food intolerance. The distinction between them and allergies. Okay, so the difference between food intolerance and food allergies is not widely appreciated. Okay, so like this you must be able to identify, okay, this is the word that they are referring to. Okay, so now let's take a look into the what to call it. Oh god, yeah, let's take a look into the keywords over here. So let's understand, let's comprehend this question. Scientists continue to disagree about their root causes. So what are scientists doing? So what detail is mentioned in the second paragraph? Okay. Scientists continue to disagree. Continue means what? Past also they were disagreeing. Currently, presently also they are disagreeing about the root causes of food intolerance. That is the main reasons why food intolerance happens. So regarding that, there is a difference of opinion. Some scientists are saying this, the other scientists are arguing with them, and they're saying, no, this is not the reason, this is the reason. There's a lot of argument. There is a lot of disagreement among scientists still happening today regarding the root causes. So that is the point the writer is making in the second paragraph about intolerance. What is the keyword in answer option B? The symptoms are indistinguishable from those of allergies. Okay, so here he's saying the symptoms of food intolerance, okay, are indistinguishable from those of allergies. That is, we cannot differentiate. Okay, we cannot differentiate the symptoms of food allergies and food intolerances. Like this, if you get food allergies and if you get food intolerance, you'll be getting the same symptoms. We cannot differentiate them. Now, third answer option, they can have an unpredictable impact on the person affected. Okay, that is, if a person gets affected with intolerance, okay, not allergies, if they get affected with intolerance, it can have an unpredictable impact. We can never tell how it is going to manifest in the person. And finally, the distinction, that is the difference between intolerance and allergies is not widely appreciated. Okay, that is the people, the society, okay, society or the medical community and all, they are not really appreciating the difference between food intolerance and allergies. Okay, that distinction is not being appreciated. So that is answer option D. Now let's do the verb analysis. So let's take a look into the verbs over here. Scientists continue to disagree. So what is the verb over here? We can say continuing to disagree. So regarding food intolerances, okay, not we can say this is the point. Okay, so you can say the point. Okay, the point that is made over here is there is a big disagreement going about the root causes. What is the verb in answer option B? The symptoms are indistinguishable. Okay, the symptoms are indistinguishable. That is the verb over here. What's the verb in answer option C? They can have an unpredictable impact. Okay, that is the impact is completely unpredictable, and that is the point over here. And finally, the distinction between them is not widely appreciated. Now you see over here, not widely appreciated. That is the verb over here, and that is what the writer is trying to tell us. Now you see, very long, lengthy options are now much more smaller. Okay, continuing to disagree, symptoms are indistinguishable, unpredictable impact, not widely appreciated. So you should have a memory of these, the question, as well as the answer options in your mind. Now let's go to the second paragraph. Okay, let's take a look into the second paragraph here. Okay, so what specific point they're talking about? Food intolerance. That is what we need to find out. Yeah. And allergy. So here they're talking about allergy. Huh? They're not talking about food intolerance. So the first sentence about allergy. And allergy, according to immunologist, is the immune system overreacting. Okay, so we have an immune system, right? So our immune system overreacts to a substance that would ordinarily be considered benign. Benign means harmless. Okay, so if a harmless, so for example, imagine two people. One person is having asthma. The other person is not having asthma. Okay. So in a healthy patient, when a benign, like for example, let's say dust. Okay. Dust enters a healthy patient's body. Okay. So the immune system will react. The immune system will react and it will remove the dust away. But in an asthma patient, the dust is entering the patient's body. But what is the immune system doing? It is overreacting. Okay. It is overreacting, okay, to a harmless substance. That is what we call as an allergy. Okay. Now he is saying, however, that's a contrast phrase. Okay. Contrast phrase means it is now they're talking about a signal change. Now see over here, they're talking. However, the term allergy is used more loosely by the general public. Okay. So see, according to the scientist, according to medical literature, we have a specific definition. What is allergy? Immune system overreacting. Okay. But the general public means what? The normal people. So the normal people, they don't have medical knowledge. Okay. So the term allergy is used very loosely. That is, even if it is not an allergy, even if it is something else, the general people will use the word allergy only. The third sentence, people say, now what are people saying? People say they are allergic to a substance because it brings some kind of adverse reaction in their bodies. So if a person is eating something, okay, and if they get any kind of adverse reaction, immediately what they will say, oh, I am allergic. I am allergic to this. Some of which can be severe and may resemble true allergic reactions. Okay, even if it is going to be very severe and also resemble means what? Very similar, same as allergic reactions. Now the word but is coming. Okay, now what's the writer saying? But unless the immune system is involved. Okay, so what is allergy? Allergy means the immune system is overreacting. So what does that mean? If there is involvement of the human body's immune system, then only it is an allergy. So if the immune system is not involved, if there is no involvement of the immune system, then it is not an allergy. But what are people doing? The people, they don't know anything about the immune system. So anytime they get an adverse reaction, and even if their immune system is not involved, even if their immune system is not involved, but they get an adverse reaction because of their lack of knowledge, they will say, oh, I am allergic. Okay. And this is what we call as intolerance. So what's the difference between food allergy and what's the difference between food intolerance? Food allergy means, so let's say example, let's say a person is eating a peanut. Okay, person is eating a peanut and their immune system is overreacting. So if their immune system is overreacting, they will get some adverse reactions. And then we can say, okay, you are allergic to peanuts. Because if you eat peanuts, your immune system is becoming overreacted. Okay, it's getting overstimulated. But we have another person. That person is eating peanuts. But that same person, the person is eating peanuts and they're getting the same reaction, the same symptoms of allergy they're getting, the same adverse reactions are getting, but their immune system is not involved. Their immune system is not involved. So it is not food allergy. Those type of things are what we call as food intolerance. That means that person is intolerant to peanuts. Okay, so this is the difference between food allergy and food intolerance. Right. Now let's see what they're saying. Constant sneezing, itchy eyes. Okay, eyes are itchy, itchy throat. Okay, inner ears are itching, asthma, rashes, diarrhea can all be signs of food allergies. Okay, so all these things are signs of food allergies. And now over here, intolerance can bring on similar warning signs. So here also they're telling even if the immune system is not involved, if a person is intolerant, they can get similar warning signs, okay, as well as things such as headaches, as well as means what? Along with these, okay, so sneezing, itchy eyes, throat, inner ears, all these things are signs of food allergies. But intolerance has some additional symptoms. Additional, what are the additional symptoms? Headaches, bloating, and general lethargy. Okay, so these three things, that is headaches, allergy, lethargy, and bloating, these are only related to intolerance. They are not related to food allergies. Okay, so these are additional symptoms of food intolerances. So, but they can, again, all these symptoms can come in food intolerance, but in intolerance, we have these three separate symptoms: headaches, bloating, and general lethargy. Lethargy means what? Weakness. Over time, over time means gradually, some allergy sufferers, they lose weight. Okay. So if a person is allergic to food, they lose weight because there are so few foods they can eat. See, whenever they eat food, their body is overreacting. So they cannot eat much food. So over time, they lose weight. Of course, the social implications. Social means what? Society. Okay, social means society. Okay, the society implications are huge. Eating is a major social event. So if you're going to a friend's birthday party, if you're going to an anniversary, if you're going to a wedding, okay, if you're anytime, okay, if you're going as a guest to someone's house, someone is visiting your house, what you're going to do? You're going to serve them food. Okay, so in our society, eating is a major social event. Okay, so if a person is allergic to foods, then the social implications will be very big. That is, they cannot eat anything when they go to social gatherings. Okay, this is for food allergy. Okay, so like this, we have like understood the question. I mean, the answer options over here. I mean, the text over here. Okay, now let's go to the A, B, C, and D. Okay, now let's see what answer options we can eliminate and what answer options we can keep in the thing over here. So what is answer option A telling us? Scientists continue to disagree about their root causes. So what is the verb in answer option A? Continue to disagree. That is, scientists are fighting with each other. So did we read this verb anywhere? We did not read this verb anywhere. So very, very easily, we can eliminate answer option A. Now, what is answer option B? The symptoms are indistinguishable from allergies. So is that mentioned? So we can say, yeah, it is mentioned. Okay, we can say this point over here, it is mentioned. That is, the symptoms of allergies and the symptoms of food intolerance are basically the same. Okay, but when it comes to food intolerances, what is there? Some additional symptoms are there, like headaches are there, lethargy is there, okay, bloating is there. Okay, so what you can do, we can say, okay, the keywords are mentioned, the verbs are mentioned. So what you can do, you can put a question mark over here. Okay, it could be the right answer. Now, what about C option? They can have an unpredictable impact. Okay, so about food intolerance. Okay, so did we read anything about food intolerance having a unpredictable impact? That is not mentioned, right? But actually, a very predictable thing they have mentioned. So, what's the prediction? So, if a person is allergic to foods, what happens? They will lose weight. So, that is the prediction. Okay, the prediction is they will lose weight. And also, whenever they're going to a social gathering, okay, in a social gathering, they will not be able to, enjoy that social gathering because they are allergic to foods. Okay, so that is the prediction that we discussed. And again, regarding food intolerances, like food intolerance has an unpredictable impact on the person, that is not mentioned. Okay, so what we can do, since the verb over here is not mentioned and it is not especially linked to food intolerances, we can eliminate answer option C. Now let's come to answer option D. Now what is the D option telling us? The distinction between them and allergies is not widely appreciated. Okay, the difference. So the difference between food intolerances and allergies is not widely appreciated. So is that mentioned over here? That is also mentioned. Okay, that is, for example, if you see over here, what did we read? Okay, we read that the general public, okay, people who don't know medical knowledge, every time they get an adverse reaction, they say, oh, I am allergic. So if a person is eating peanuts, okay, even if their immune system is not involved, what they will say, oh, I am allergic to peanuts. But in reality, is he allergic to peanuts? No, he is actually intolerant to peanuts because he is getting the same reactions, but his immune system is not involved. Okay, so what is the writer telling us? The writer is telling the difference between food intolerance and the difference between food allergies, it is not widely appreciated. So we have two answer options. That could be right. So now we are confused between B or D. The symptoms are indistinguishable and the difference between them is not widely appreciated. Okay, so now you what you have to do? Now you have to once again go back to the paragraph. And now you have to determine, okay, between B and D, which is the most appropriate answer. Okay, so for that, let's go once again to the paragraph. Okay, and let's see what will be the most appropriate answer. Now you see over here, the writer, he is saying, see here he's specifically mentioning that the term allergy is more loosely used by the general public. Okay, that is answer option D is clearly mentioned over here, that the term allergy, it is used more loosely by the general public. People say they're allergic. Now see this third sentence also, they're telling people say they're allergic because it brings about some kind of adverse reaction in their bodies, even though it may be similar and it resembles true allergic reactions. Now he is using the word but if the immune system is not involved, then basically it is food intolerance. Okay, and intolerance can bring on warning this is mentioned. So we can see over here D, answer option D. Okay, that is the point over there. Okay, the point is people are not appreciating the difference between food intolerance and food allergy. Okay, that is that distinction, that difference is not appreciated. Everyone say, even if it's a food intolerance, everyone is saying, oh, I am allergic, I am allergic. Okay, so the D answer option is very strongly mentioned over here. Now let's come to answer option B. Okay, now what is answer option B telling? The difference, okay, that is the symptoms are exactly the same. The symptoms of food allergy and the symptoms of food intolerance are exactly the same. It is indistinguishable. But you see over here they have mentioned headaches, bloating, and lethargy. And these symptoms are only associated with intolerance. Okay, so these food allergy, okay, food allergy does not have headaches, it does not have bloating, it does not have general lethargy, only intolerance asset. You see, similar warning signs, but along with that, unique symptoms associated with intolerance, and that is these three headings. So between B and D, which will be the most appropriate answer? So now you can say yes, between B and D. So you were confused between B and D, right? So between B and D, you can say, even though you're confused between B and D, and we have already eliminated A and C. you can say that answer option, what? Answer option B is little bit easy to eliminate. That is, we have additional, that is headaches, bloating, and lethargy. Those are specific to food intolerances. Okay. So the more precisely mentioned answer, the most difficult answer to eliminate is answer option D. That is, it is not widely appreciated. The difference between them is not widely appreciated. So this is also a slightly tricky question, right? But not too difficult. I wouldn't say it is a very difficult question. It is challenging, but the trickery. Okay, so here also, once again, that elimination strategy you need to bring in. So this clarity you must have. Okay, and that clarity will come by understanding the question type, by understanding what your duty over here is, by identifying the keywords, by linking the keywords together to the question, identifying the verbs, understanding the paragraph, that is reading with an aim. Okay, reading with an aim, and then trying to eliminate the incorrect answer option one by one. So usually one or two you can very easily eliminate. One or two very easily you can eliminate. Or you will become stuck between two answer options. Okay, so between those two, you have to once again go there and you have to see, okay, which answer option can I eliminate? Don't focus on choosing the correct answer. Try to eliminate the incorrect answer options. And whichever answer option is the most difficult to eliminate, that will be the right answer. And of course, so you will make mistakes. So every time you make a mistake, you write down, okay, this is the reason why I made a mistake. So in the future, I need to prevent the same thing from happening. So like that, you make some notes and you discover what strategies works for yourself. Okay. So this is what reading part C is all about. So let's have a very small recap. So in reading part C, you will not be getting emails, you will not be getting guidelines, you will not be getting protocols. Everything will be a writer and author has written a passage. So it is a conversation. The writer is speaking to you. The writer is speaking to you. So you must be able to think like the speaker. You must be able to reason like the speaker, identify the opinions of the speaker and all that. That is extremely important. And then come to the question. The OET is not giving you marks for reading the passage. The OET is giving you marks for reading the questions, for understanding the question, and eliminating the incorrect answer options and choosing the correct answer option. Okay. And then bring in the comprehension strategy, that is keyword analysis. Understand what the question is asking you, understand what type of question this is. And then you go to the answer options, identify the verbs over there, have a very good memory of the question. Okay, you must have a very good memory of the question. With that memory, you need to go to the passage and you should try to comprehend the passage. Think like the writer, think like the person, and then eliminate the easy answer options to eliminate. You will become confused between one or two. And those answer options you try to eliminate. Don't try to focus on selecting the correct answer, eliminate the incorrect answer options. And that is the perfection that you need to develop. Right. So all these recorded lectures are available. So in the OET Exam Mastery App, we have very detailed recorded lectures, 24/7 availability is there. All you just have to do is just open the app and access the recorded lectures. Make some notes. Okay. So making some notes is definitely going to help you out. Repeat yourself. Okay. That is, repeatedly do the same materials over and over again. Okay. And then become very thorough, become very confident, develop the right skills, then confidently book the exam and pass the OET and live your dream life. Right. So that is what you need to do over here. That is reading part C.